Hey guys, what's up? So in this video, what I wanted to do is talk a little bit about the therapeutic benefits of just listening to your patients. It sounds really simple. It's a topic that we're taught in medical school. It's something that everybody, I think, learns throughout the process of medical training, but it's also something that we kind of lose in actual medical practice because what happens is, life becomes very demanding. When you have a list of 20 patients to see, it's very hard to sit with every one of those patients and have a long discussion and listen to their problems and hear them out. But there were two recent encounters that I had that really kind of led me to want to make at least a comment on this. Because both of these patients had kind of told me the same thing, which was that nobody actually stopped and took a little bit of time out of their day to just listen to their story, to just hear their concerns. And I think all too often that this is exactly what happens. We come into a room, we talk to the patient for, 30 seconds, we tell them what we're going to do. We don't really assess very well whether or not the patient understands what we're going to do and how we're going to do it and how their process is going to be. And then you kind of leave the room and they're left there to say, well, what is this doctor doing for me? What, I don't even understand. They don't talk to me, they don't listen to me. And they don't even seem to know or care what's going on with me. And what I'll say is in psychiatry, obviously that's a little bit different because we are a field specializing in discussion and talking. So that is a large part of what I do is talk to people, listen to their stories, and figure out how I can best help them, right? And so with that said, the therapeutic benefit of just sitting there and listening to somebody, just actually hearing what they have to say. And in both of these encounters, I did very little talking. I barely talked at all during the encounters. In both cases, I was basically there just sort of to listen, to empathize, to share a little bit, but not to give too much advice. And the therapeutic benefit was pretty amazing. These patients really seemed to improve. We formed a really great therapeutic alliance. They trusted me. They allowed me then to make changes, to do things, to help them as best as I saw fit. And the whole relationship dynamic changed because these were seen as sort of problematic patients. They don't listen, they're non-compliant, etc. And what a lot of it came down to is that they just felt like they weren't being treated appropriately. So taking that little bit of extra time out of your day, taking a few extra seconds to talk to somebody in the hallway, taking a few extra minutes to kind of hear a patient's concerns and stories and things that are bothering them or things that even are making them happy can really go a long way in your ability not only to form therapeutic alliance, but also to get the patient to be more compliant with the things that they need to do to help themselves, to have the patient have a more positive experience. And in the end, that's the whole goal. All I'm trying to do is get people better and make them feel better. At the end of the day, I want them to be better. So if that means taking a few extra minutes out of my day to talk, and even on a busy day, then I'm willing to do it, and I would encourage more physicians to also do the same.